So our next case here is, surgical resection here. You can see it's fairly abnormal even at this low power, where we start to see this quite cellular areas. And we do see a lot of blood as well. Just a note about blood in the lungs. Much of it is actually artifactual. That's from the procedure itself. But real hemorrhage is when you start to see this hemosiderin deposition that accumulates in these alveolar macrophages here. And so the hemosiderin is typically this kind of brown, chunkier pigment that you can see throughout this case. And so this further suggests, along with there's some focal areas of fibrin as well, there's an aspect of hemorrhage associated with this lesion. So we zoom back out to a little bit lower power. You can see that there's this cellular area here that's really tracking along the bronchovascular bundle. So that we have an airway and a vessel here. We have this cellular proliferation around the bronchovascular bundles. It's also a bit in the interlobular septa. And then when we go down to higher power, we can see that it's a spindle cell proliferation. And it's the proliferation of these relatively bland cells. We do note that there's relatively prominent ectatic vasculature associated with this lesion, as well as we see that some of the cells actually have intracytoplasmic lumina, as well as we see a number of extravasated red blood cells as well throughout. And so this should clue into your mind that this could be a vascular lesion. And an important vascular lesion in the lung is actually a Kaposi sarcoma, which typically has this relatively monotonous proliferation of these spindle cells and these fascicles. We see these complex vascular channels. We often see extravasated red blood cells and intracytoplasmic lumina formation. And then we can confirm this diagnosis with actually an immunohistochemical stain. So this is an immunohistochemical stain for HHV8, which is positive in Kaposi sarcoma. And so these cases are classically associated with HIV, in which they develop, and or other immunodeficiency states.